If you've noticed a little pink in the sink after brushing or flossing, you're not alone. Up to 75% of pregnant women experience bleeding, swollen, or tender gums, often one of the first and most overlooked signs that pregnancy is influencing more than just your growing belly. While your mind may be focused on prenatal vitamins, baby names, and nursery colors, your oral health deserves a front-row seat in your prenatal care plan. Why? Because gum health during pregnancy is closely linked to serious pregnancy complications, including preterm birth and low birth weight. This isn't meant to alarm you, but to empower you. Understanding the hidden connection between your gums and your pregnancy allows you to take proactive, safe steps to protect both your smile and your baby. Here's what every expecting mother must know. Pregnancy triggers a dramatic hormonal shift that directly impacts your oral environment. Estrogen and progesterone levels rise significantly, which intensifies your gums' reaction to plaque, the sticky bacterial film that constantly forms on teeth. Even a small amount of plaque that may have previously caused minor irritation can now lead to swollen, red, and bleeding gums, a condition known as pregnancy gingivitis. But hormones aren't the only culprits. A perfect storm of factors converges: reduced saliva flow. Many women experience drier mouths, which means less natural rinsing away of food particles and bacteria, leading to increased acidity and cavity risk. Dietary changes. Cravings for carbs and sugars combined with morning sickness increase your exposure to enamel-eroding acids and cavity-causing bacteria. Altered immune response. Your body naturally suppresses its immune response to protect the fetus, but this also makes it harder to fight off the bacteria that cause gum disease. Oral hygiene challenges. A heightened gag reflex can make brushing and flossing difficult, leading to less effective plaque removal. This is the most critical reason to pay attention to your oral health. What begins as simple gingivitis can escalate into periodontitis, a severe gum infection that destroys the bones supporting your teeth. This isn't just a dental issue, it's a whole body issue. When periodontitis develops, the inflamed gum tissue acts as an open door, allowing harmful bacteria to enter your bloodstream. Once in circulation, these bacteria trigger a systemic inflammatory response. Your body releases inflammatory chemicals, such as prostaglandins and C-reactive protein. Here's the crucial part. Prostaglandins are the very same chemicals used to initiate labor contractions. When these inflammatory signals flood your system prematurely, they can cross the placental barrier and potentially trigger early cervical changes and uterine contractions. This chain of events significantly increases the risk of preterm delivery and low birth weight babies. Research shows that women with periodontal disease may face a 2 to 7-fold higher risk of preterm birth. Furthermore, this systemic inflammation is also linked to an increased risk of developing preeclampsia and gestational diabetes. A common and dangerous myth is that dental care should be avoided during pregnancy. The opposite is true. Preventive care is essential, and the second trimester, weeks 14-20, is the ideal and safest time to receive dental treatment. First trimester. This is a period of critical organ development for the baby. While emergency care can be provided, elective procedures are best postponed. Second trimester. The baby's major structures are formed, and the mother is typically more comfortable. This is the perfect window for cleanings, fillings, and even more urgent procedures like root canals or extractions. Third trimester. While cleanings are still safe, lying on your back for extended periods can be uncomfortable due to the pressure on the vena cava. Procedures are kept short and sweet. Are dental x-rays safe? Yes, with precautions. Modern digital x-rays use extremely low levels of radiation. If an x-ray is essential for diagnosis, your dental team will double shield your abdomen and thyroid with lead aprons. The radiation exposure from a dental x-ray is far less than what you'd receive on a cross-country flight. Is local anesthetic safe? Absolutely. Lidocaine with epinephrine is the most common local anesthetic and is classified as Category B, meaning it's considered safe for use during pregnancy. It does not cross the placental barrier in significant amounts. What about antibiotics? If you have a dental infection, safe antibiotics include penicillin, amoxicillin, and clindamycin, all Category B. Always ensure your dentist knows you are pregnant. Professional care is only half the battle. Your daily routine is your first line of defense. Upgrade your brushing technique. Use a soft bristled toothbrush and fluoride toothpaste. Brush gently for 2 minutes, twice daily, paying extra attention to the gum line. If brushing triggers your gag reflex, try a smaller brush head or brush at a time of day when your nausea is less severe. Don't skip flossing. Flossing removes plaque between teeth where your brush can't reach. If traditional floss makes you gag, try a water flosser or floss picks. Rinse wisely after morning sickness. Do not brush immediately after vomiting. Stomach acid coats your teeth, and brushing can wear down the softened enamel. Instead, rinse with a mixture of 1 teaspoon of baking soda in a cup of water to neutralize the acid. Wait at least 30 minutes before brushing. Use an alcohol-free mouthwash. An antimicrobial, fluoride-containing mouthwash without alcohol, like ACT or Crest Pro Health, can help reduce bacteria without causing dryness. Try a soothing saltwater rinse. Dissolve 1/2 teaspoon of salt in a cup of warm water. Swish for 30 seconds to reduce inflammation and soothe irritated gums. This can be done 2-3 times a day. Eat for your smile. Support your gum health with nutrients. Vitamin C, citrus, berries, broccoli. Strengthens gums and helps repair connective tissue. Calcium, dairy, leafy greens, fortified foods. Strengthens teeth and bones. Vitamin D, sunlight, fortified milk, fatty fish. Helps your body absorb calcium and supports immune function. Some women may develop a pregnancy tumor, pyogenic granuloma, on their gums. Don't let the name frighten you. It's a benign, inflammatory overgrowth of tissue that appears as a red, raw-looking lump that bleeds easily. It's often caused by localized irritation and excess plaque. While unsightly and sometimes uncomfortable, these tumors usually disappear after childbirth. If one interferes with eating or brushing, your dentist can safely remove it during your second trimester. For a toothache or dental abscess, throbbing pain, swelling, fever, contact your dentist immediately. A dental infection is a source of bacteria that can spread and poses a risk to both you and your baby. Safe treatment, often including a root canal, is far better than leaving an infection untreated. Can gum disease during pregnancy really cause preterm birth? Yes. Extensive research has established a strong link. The bacteria from severe gum disease cause inflammation that can trigger the processes of early labor. Is it safe to go to the dentist while pregnant in the second trimester? Yes. The second trimester is widely regarded as the safest and most comfortable time for both routine and necessary dental care. What are safe antibiotics for a dental infection during pregnancy? Penicillin, amoxicillin, and clindamycin are all considered safe and are commonly prescribed. Always inform any healthcare provider that you are pregnant. How can I treat pregnancy gingivitis at home? Meticulous brushing and flossing are the foundation. Incorporate an alcohol-free fluoride mouthwash and saltwater rinses to reduce bacteria and inflammation. Your action plan. A checklist for a healthy smile. Schedule a checkup. Book a dental cleaning and exam for your second trimester. Communicate. Tell your dentist you're pregnant and your due date. Inform your OB/GYN about any dental work planned. Practice consistent care. Adapt your home routine to manage nausea and be extra thorough. Snack smartly. Choose nutrient-dense foods over sugary treats to support your oral and overall health. Your journey through pregnancy is a beautiful and complex time. By prioritizing your oral health, you are taking a simple yet profoundly important step toward protecting your well-being and giving your baby the healthiest possible start.